But this comes after an infected child took part in a community event.
I'm scared. I'm really scared that there's going to be more widespread transmission in our community.
Well, 2025 saw the highest number of measles cases in more than 3 decades in the U.S., and we're already on track to break that, and it's only March. Thanks for joining us for the CBS 13 News at 5. I'm Dominic Garcia.
And I'm Marley Ginter. After 3 measles outbreaks in our region since the beginning of the year, public health officials are sounding the alarm.
Your reporter Kayla Moeller live near UC Davis Children's Hospital getting answers on what this all means.
Yeah, well, Dom and Marley, there have been at least 6 confirmed cases of the measles across Sacramento and Placer counties. And one case that was reported this week involves a child who attended an educational event while infectious, possibly exposing more than 100 other children.
1, 2, 3. Happy birthday.
1-year-old Riley is going to her 1-year checkup. And in that checkup, she'll be receiving her vaccinations, including the MMR, which covers measles.
Because I want her to be safe, and I want to not have to worry every time I take her out into a public space that she's going to end up with a crippling illness and sicker than she needs to be.
The California Department of Public Health is urging all parents to ensure their children are vaccinated after multiple outbreaks since the start of the year, including 6 measles cases in Sacramento and Placer counties.
We know that measles is one of the most, if not the most, contagious disease known to humans. And so all you need is a small drop in the immunity level in a community, and you can get transmission.
130 children recently attended an enrichment program in Sacramento County. And unfortunately, one of those children was infectious with measles during that time.
It is so infectious that if somebody is infectious and they walk into a room, it can stay suspended in the air for up to 2 hours. So you don't even need to have person-to-person contact with somebody to get infected.
Sacramento County says contract tracing is underway as they deploy full resources to contain the spread.
So children who were in that educational program who are vaccinated, are they safe?
Yeah, so what public health usually does in a situation like that is look at the kids who are up to date with vaccine, and then for them, they're safe and they don't need to be quarantined or isolated. Those who aren't vaccinated or who are under-vaccinated, then they'll ask the family to keep that kid out of public spaces.
Children can be infectious for up to 4 days before they start showing symptoms. But measles is tricky because symptoms start off similar to a cold until about 1 to 3 weeks in, when a splotchy rash can develop starting on the face, making its way down the body.
I feel for the parents. I worry about the kids, and I worry about if those kids do contract and then they're out, and it's just going to continue to spread.
Yeah, Dr. Blumberg says that for the county public health department, it's estimated that it costs them around $75,000 per measles case. So they are really working hard to mitigate the spread. And the state public health department says that it's possible that this all originated from a toddler who traveled recently to the state of South Carolina. South Carolina right now has more than 1,000 measles cases. And Dr. Blumberg also says if you're going to be traveling, it's very important to make sure that you and your family are all up to date on vaccinations. He also says that if you can't remember, you don't know if you have your MMR, that it is okay to go ahead and take it again.